speaker is Dr. S.S. Pandav, and he's going to be talking about the academics and clinics in the government.
Thank you, Chairman Sir and AIOS for including us into this program. PGI Chandigarh was started as Institute of National Importance by the Government of India with a mandate to provide high quality patient care, self-sufficiency in postgraduate medical training, also to train teachers and leaders in ophthalmology and other specialties of medicine, training healthcare personnel, and also conduct research which is relevant to our society. So this is the mission statement: service to the community, care of the needy, and research for the good of all. So all this boils down to basically is that we have a good patient care. The patient is at the heart of these activities, and that's the end user. So whatever our efforts are, they should be to provide good care to our population. And what we mean by good care is basically that the care should be accessible to all. It should be equitable, it should be affordable, and it should be of high quality. The discussion today is, for me, is that how do we position our clinics and academics to provide that kind of a care to our community. So my point of view is that the academics, the clinics, and the patient care, they are actually integral part of the same system. You can't really separate them. You know, you can't take out one of them without affecting adversely the other two. So they all have to be integrated, because to provide good patient care, you need a good physician, a good clinical setup, and trained manpower. And that the process of providing a good care actually results in a good experience, which improves the skills of the treating physicians and also provides interaction and leads to opportunities to do more research, which again adds to the academic knowledge. And that knowledge again percolates down to the clinics, to the treating doctors, and they provide better care to the society. So this is a cycle which has a positive loop. I would say is a magic cycle. And this is very important for the continued healthcare, improvement in the healthcare delivery system, and also to the improvement of the quality of the services. So in PGI, we try to provide the highest quality care to our population, which is accessible. So our hospital is actually even if it's a tertiary eye care center, but we allow walk-in patients. We have a referral program. We also have an appointment system, but we don't follow it very strictly because people do get blocked out if you're too strict in this. So we allow patients to come in even without appointment. We provide services to all without any differentiation in the poor or rich, or differentiation based on caste, creed, or religion, or status of the person, and also without any geographical boundaries. So we see patients from all over India and also abroad. Our care is very nominally charged actually, and is almost free to most of the needy patients. So we also are part of the Ayushman Bharat scheme, which is an kind of insurance program for the poor patients, and a lot of people are benefited with that. Even the high-end procedure like LASIK, SMILE, femtocataract surgery, they are highly subsidized at our center. We have a very well-trained staff and well-equipped clinics to provide state-of-the-art and excellent care to our population. The organizational services is based on subspecialty. We have a general OPD and also community ophthalmology wing, and where patient can actually walk in and without any appointment have their problem sorted. We also have clinics like cornea clinics or refractive surgery, retina, ROP, uveitis, glaucoma, pediatric ophthalmology, and many other clinics. And all these clinics are very well supported by clinical labs, as well as research lab, operation theaters, and also wet labs for the training of our residents. So academic programs, we run a number of academic programs, and we have a very well structured and robust program, which has been running over the years. So we have a junior residency, which is for 3 years. We have senior residency, another 3 years. We also have fellowships, 1-year fellowship in glaucoma. We have started MCH program for advanced subspecialty training in retina and cornea. We have a number of PhDs working in our laboratories. We also have an optometry school of optometry. And in addition, we have several observerships positions and also short-term training programs, which we organize, which are open to other people, other hospitals in the region. And many people from the government organizations, they actually visit us from time to time. In addition, our faculty contributes to almost a number of conferences, etc., throughout the year. We are also at the forefront in research, and because of the very good lab setup and also very good clinical setup, we are a place where the bridging the gap between the clinicians and scientists is actually can be done. And we look forward to people joining us here so that we can do more research. The PGI has contributed over 1,600 such papers this year alone. And out of that, about 200 were contributed by the Eye Research, Advanced Eye Center. So PGI is a success story. Advanced Eye Center is a success story. We are #1 destination for patients in this region for patient care. Our alumni are occupying very high positions in many organizations in India as well as abroad. And we are usually among the top 5 in terms of providing clinical services and also in terms of research output. Being a government organization is a great help to us actually, because we don't have to worry about generating funds. Our staff's salaries, equipment, infrastructure projects, staff development projects, they are all taken care by the government. That's the reason we can be more accessible to people, and also we can be very economical. But this all is happening because we take care of our population. We keep the patient in the center of our vision, and our activities are actually, they revolve around this patient. And this also helps because we generate a lot of happy patients. And as Dr. Bhujang Shetty said in his talk, happy patients are the best ambassadors, and they go back to, to the decision makers, policy makers, to give a good feedback. And that helps us generate more funds. To summarize, the good clinics and good academics programs they go hand in hand. They are not inseparable. Excellence in patient care is of fundamental importance, and the government institutions can provide accessible, equitable, affordable, and excellent care. Thank you very much for giving this opportunity to speak. Thank you.
Thank you very much. It was a lovely in view of all the good work you're doing at PGI and the eye care that you're providing to people with, all status.